Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
Kerry Fink with Helping Seniors of Brevard. Welcome to Helping Seniors Television. I have the privilege of sitting in for our president and founder, Joe Steckler. And as you may know, Helping Seniors of Brevard is a Florida nonprofit corporation, and we're dedicated to helping seniors age with dignity and gracefully. And we operate the County Senior Information Helpline in Brevard County, Florida, which is the Space Coast of Florida, as many of you know. 321-473-7770 is our telephone number, 321-473-7770. And we take actually someplace between 125, 150 calls per month from seniors who are looking to connect to resources that are going to benefit them and help them navigate the process of aging. And so one of the things that I have the privilege of doing on today's television show is introducing you to Sherry Garofalo, who is Forget-Me-Not Senior Care Advocates. And we're talking about resources and people who can help you as we go through the aging process. Thank you for being here today.
Kerry, thank you so much for having me.
So I wanted to ask you, because you have a fascinating background, you really understand the medical side of things. You've come up and had a good, successful career as a respiratory therapist, and we were talking before the cameras were rolling, for 7 years now. You've had your own senior care advocate organization, Forget-Me-Not. But maybe we start by introducing Sherry to viewers who may or may not have known you from before.
Thank you. I started as a respiratory therapist doing hospital work, primarily emergency room, ICU, and circumstances have pushed me from one thing to the next. And talking to a physician one day, he offered me a position, leaving the hospital full time and working in his office. Then I went to medical equipment, and then I went to skilled nursing. Someone said to me, I think you'd be great at that, coordinating people going from the hospital to rehab. And everything that I've done has just been the next layer of the information that I was going to need to be able to do this. You know,
one of the things that I think is so fascinating is when I think about the job of a respiratory therapist, you really are meeting people not under the best of circumstances and probably in kind of a mode of crisis, especially when you mention emergency room and things like that. So one of the things that must have helped you prepare well for a career of being a senior advocate, because when you run up onto a situation, it's probably not your first rodeo. You have experienced and you know how to maneuver in a given situation.
I think that's actually an excellent point. I don't think about it often enough. Respiratory therapist is largely medical crisis management.
Sure.
Yeah, they're the people that are going to get called when there's a crisis or respond to crisis. So my panic level is probably pretty high. So I tend to, just by the nature of it, tend to be normally calm in most circumstances. So when we come against things, people are either going to call you when they need something from a case manager, senior care advocate, prophylactically. We're thinking we might need something in the future, we just want somebody on board. Or they're going to call you when it's a crisis. There doesn't usually seem to be too many in-betweens kind of things. But that's just all of us in human nature.
Right.
So, you're right. It does really help a lot, I think, that managing it throughout time.
Well, see, one of the things, Joe Steckler, who's our president and founder, he's often talked about the need for establishing an aging plan. And I find myself saying this a lot. When we're youngsters growing up, they tell us, okay, think about the courses you're going to take in school. Maybe you're going to take a college or a training course, because what is the job you want to have when when you grow up? So they give us a plan for growing up. And then we come up with a plan for while we're in our working years. They say, well, this is good, but you need to be setting aside some thought for your retirement. You need to be, maybe you have children and you got to think about, well, are they going to go to college? Do I need to prepare for all that? So you have all these issues to deal with. And then when we arrive at the point where we think we're maybe going to retire, now the question is, as Joe often says, is do we have an aging plan, and how have we thought about those years of our lives to handle any contingencies and things that are coming up? And so when you introduce yourself as a senior care advocate, it seems like you could really be help to a lot of people. Although one of the things that we often talk about, and you just hit on it, is, you know, I'm sure if we call down to any fire department in the United States and say, we'd like to have you come over and look at the house and tell us, do we have any safety issues that we should be concerned about preventing a fire, they would much rather take the time, come out and say, well, that gasoline can is a little too close to this, or things like that, that they might, or you got too many things plugged in over here, whatever they might tell us. They would probably much rather take the time to do that than all of a sudden the house is on fire, now we got to, you know, just deal with whatever's left. Tell me, what does a senior advocate do? It sounds like you can be on both aspects of that.
You know, we actually can. So in a perfect world, we'll do an initial assessment. And again, in a perfect world, it's not in the middle of a crisis. We can manage either way, but in a perfect world.
Right.
So when we'll go in and we'll meet with the clients and or their families, whoever wants to be involved in this, and we'll actually look at their perceived needs and then try and get an idea of what the overall needs might be. And we actually do a plan of care.
Okay.
So we can look and say, you know, have you ever thought about getting a housekeeper? Maybe, you know, if you thought about, because various things there are very often, you're talking about safety hazards.
Sure.
You know, are there rugs? Are there newspapers piled up where you're walking through? Or is it, you know, you kind of get a feel, or are they immaculate? I mean, there's always different kinds of things, but they might need grab bars. Things like you can kind of tell that maybe someone's balance is off if they're, we've all seen it, where people, it's called furniture walking, where they're afraid to let go of something.
Sure.
You know, maybe they need a walker or a cane. So we'll sit down and we'll ask them, what challenges are you noticing? What needs might you have? And families will give input. And part of the clinical assessment, we get records from physicians. We'll talk to the physician and or their staff, try and paint a big picture. And then we can do like what's called as a plan of care. So do you need help going to the doctor's appointment? Do we need to try and get some home health care, Medicare, PT, OT, things like that in here for you? Do you need some companions? You know, there's some great companies out there that can come in and take you to the grocery store, maybe cook some meals, or maybe help you tidy up these rooms. I mean, there's various different things. So when we do the initial, then we do a plan of care.
So, well, with that thought in mind, I wanted to ask you this question. So, we often talk about in the Helping Seniors world that aging is on-the-job training. We really don't know until we get there. And even though we might think we're bright or we're intelligent or we have a good ability to research things and figure things out, the problem is once we run up on something that we're not familiar with, it seems like decisions have to get made quickly. And these are not simple decisions. These could be life or death decisions, but we really don't have the body of experience to be able to maybe correctly decide what to do. And so then we're hearing maybe different opinions. One doctor says one thing, another person says, you might think about this. It seems to me that is a role, am I asking the question the right way, a role of a senior care advocate is to help us navigate through those difficult moments.
You know, a lot of times it is. I try and say basically I'm a secretary and an educator. You know, because none of us can make good decisions and no one can give good advice unless we have good information. So it's gathering of that information and tracking that information. We employ RN case managers. They're board certified. So, and because we're all leaning on a little bit older, so we have more experience, but we're basically old. But we've been doing this kind of a long time. We can kind of give statistically educated guesses in regards to, in these circumstances, these are likely outcomes. That doesn't mean that we're God. That doesn't mean that I can tell you what's going to happen tomorrow. But we can help guide you. And kind of the tagline with Forget Me Not, guiding seniors and their families. We're going to help guide you. We're going to try and give you good information. And I think that really is key. My job is not to make that decision for you.
So a question I wanted to ask you, because as we get older, you know, we might be thinking of ourselves, or we could be the adult children of parents who are aging. Maybe we get calls a lot of time on the Senior Information Helpline from a adult child who might be living up north, but came down to visit mom or dad over the holidays and realized that while they sounded fine on the phone, maybe things don't look quite as good at home, and they're a little bit concerned but don't know what to do. Is that the kind of thing that you guys might get involved with?
You know, we can. I always say, we're going to we do free consults.
Okay.
So we'll do a free assessment.
Okay.
So in some instances, I will say this, that we're going to help with competent people. We're not guardians.
Okay.
And there's a distinction in that. We can help you as long as you're able to make all your own decisions. We can help if a family member all the paperwork's in line, and the family member is a healthcare surrogate, a power of attorney. We can do all of those things. But if it looks like there is nobody that's in that role, and they're going to need a court-appointed guardian in the near future, then usually we will coordinate with local guardians and get them in as the case manager to, you know what I mean?
Right.
And then you can do some of those things, or if there's questions, we'll turn to that. But what we can do is, especially if if the paperwork's there and they're healthcare surrogate, power of attorney, we can be the boots on the ground is the thing, and work through.
Yeah. Well, you said a key thing, because I was going to ask, is this expensive to figure out or investigate what to do? And I think you already answered a question I wanted to ask you was, well, if somebody thought, I want to take a look at this and see if this is appropriate for me, maybe I'm the me and my kids are not local, or God forbid, maybe I don't have anybody that I can really rely on that I could trust anyway. So I might need to call somebody for myself, or perhaps if I'm the adult child of the scenario I just described, where I was visiting mom and dad, and they're like, well, you probably need to look at something. We should give you a call, and start the process, because you're going to come out and have a visit and kind of see what's going on, and then draw us a roadmap of maybe what we'll do. How do people get in touch with you? Is it by phone, or what's the best way?
Probably the best way is to get in touch with us is by phone.
Let me have you give the number that somebody should call then.
Now I'm going to have to read this. You know what? I'm going to give you my cell phone number, because, you know, while we're here, let's make that easier. You can always call my cell phone number, because I'm always on call.
Sure.
And especially if we have families that are out of the area, California or something. So the best thing would be my cell phone at 321-243-6855.
Okay. And I'm going to have you say that one more time, so everybody has a
little
moment
bit
to grab.
slower.
Well, so everybody has a chance to grab a
No.
pencil, because this is a number that you're probably going to want to have.
Yeah.
Because it sounds like, so you saying somebody should give you a call, and you'll be happy to sit down with them the first time without charge, and kind of walk through, hear what the situation is about, and then kind of determine a roadmap of what could happen from here.
Exactly, and it's not, and I will repeat it again, we can be part of the solution, but we may not be all the solution. And we want to be good stewards of each individual that we come across in our paths. We also want to be good stewards of their finances. So we are private pay, but if there's instances where we can utilize other insurances, or maybe your long-term care insurance policy will cover us, we're going to do everything we can to make this as cost-effective as possible. But you can call me anytime. I'll answer questions on the phone. We'll be glad to meet with you, find out there's big a picture as we can. And it's 321-243-6855.
You know, one of the things that I don't think we often think about is as we get older, most of us would say we would prefer to have the opportunity to remain at home, but to do that safely. And so, particularly as you're talking about, we always hear horror stories about trips and falls and things like that. It seems like, and also particularly if a loved one has people that are caring for them, but they're just physically not able to be here. They're in a different part of the United States or even the world. It seems like you guys can be eyes and ears and a present help for people that are trying to navigate all this. Tell me a little about the kind of services that you guys get involved with if somebody's trying to age safely at home.
We're going to, like I said, do a little bit of the assessment, see how safe things are. See if someone is a little unsteady, see if physical therapy might help, whether it's in their home or going out to physical therapy. Maybe it just is get a cane or various different things. So we'll help with additional resources in the community and any adaptive equipment. Are there grab bars? We can help navigate all those kinds of things. As far as if someone's living alone and they're concerned about falling, getting lifelines, you know, whatever we can get those things in place. We can assist with the medication management because we have RNs, and I am not going to be the person to tell you how to do your medicine. I will tell you it's called PillPack, probably speaking, but it's kind of like a Kleenex box. All the medicines in one, you know, each dose, morning, afternoon, evening, however often you take it. It's got a date, what time of day you take it, and what medicine's in it. And for a lot of our clients, that works great. A lot of our clients are like, I really like the pill box. I'm used to it. It's familiar. That works for me. Then I'm not going to change what works for you. We did have a client that there was concerns, so you can get these boxes that will alarm and tell you it's time to take your medicine. And the woman, it really annoyed her, and she took the hammer to it. And so we decided that was not the one.
That didn't work.
But so that there's different, everyone is different. So we're not going to, there's no cookie cutter, and we can help.
So what I'm hearing is, and forgive me if I'm saying this in a way that isn't correct, what's kind of interesting is when you guys come along somebody, you are like one part, I think you use the word secretary, I might even use the word concierge, because you're there to assist them in getting through the things that need to be gotten through, whether it be medications, whether it be, we call them activities of daily living, but you know, you can help organize if they need help with showering or things like I need help getting to and from a doctor. You're able to serve on all that side.
All that stuff. And we'll go to the doctor's appointments, and we're on call. Heaven forbid somebody goes to the emergency room. We kind of have a feeling that no one should be in the emergency room alone.
Right.
If I'm sick enough to go to the emergency room, I'm not remembering what my medicine is. I can't tell you when my surgery last was 10 years ago and for what.
Right.
So we have an electric medical record system.
Wow.
That keeps medical histories, when you last got your flu shot, all the things that ER is going to ask you.
Yes.
And a list of all your medications that's updated regularly whenever they're changed.
Wow.
So when we go, that list goes with us. So their contact information, emergency numbers, and all of that. So it's printed. We just print it because it's cloud-based.
Right.
Every clinician, all of us have access to that.
Okay.
So if one of us is going to the ER, we just print it and we go. So then if we do hospital rounds, so when we go, we can give history, we can find out what's being done, we get the results of what's being done. That also goes in the system. And then we also can communicate with the families or wherever they came from, and then we do daily hospital rounds while you're there. We speak to the physicians and track what's happening and keep everybody abreast. And sometimes it's just letting individuals know this is what they're doing, this is why. You know, if I'm comfortable in an emergency room.
Right.
I'm not uncomfortable. I
Right.
don't know if I want to be a patient. But when you're in there and they're doing these things and they're sending you for this and you don't understand the language,
Right.
what's going on and what's happening. So sometimes we're just the reassurance as to what's happening and continue following. So people's needs ebb and flow.
Right. So it really seems like, so on the one hand, you're able to serve on the more, I don't want to call them mundane.
Mundane,
Nothing
but
is
it's very
but
simple.
But
Yeah.
the things that are happening around the house that we just have to make sure we're, the doctor has said it's best if mom gets this medicine in the morning, and we have all the ability to help, or she's got to be at this doctor's appointment at 2 o'clock on Thursday. Those are all things you can help with, and then we can flip it. And if we get into a situation where we're in a real medical circumstance,
Right.
you have the expertise to help navigate, not only explain what you know from the patient side to the doctors and the people that are trying to treat the patient, but also the flip side to explain to the patient what's going on when doctors are using doctor speak.
Right. And or, like if someone says, well, that this level came back. Well, I don't speak finance. I don't speak legalese.
Right.
So there's plenty of words that they use that I don't understand, or
Sure.
tech. When you're getting your computer fixed, and I would say, I hear what you're saying, but I don't know what you're saying. So we can.
You're able to break it down for where that individual is. Now, we were talking before the cameras are rolling that you said typically you find clients who work with you come in on one of two levels. And let's talk about one level is the people who are trying to prepare ahead and looking at things like that. I'm going to come back to that. But you said then the other is like you get called into the middle of the 4-alarm blaze and you're trying to do the best to navigate the situation that's facing us at that moment. Talk to us, that is a call that you will take?
Yes.
So tell me, like, mom's landed in the hospital, nobody's sure even what the next step is. This is all new information. We don't even know where to begin. Do we call you?
Yeah. And I can electronically send, there's only a couple things I'd really need. The contract signing is nice, but I need that HIPAA form that allows me to speak.
Okay.
So I can electronically send it. You can send it back to me. I can retrieve it on my phone, push comes to shove. And, there's been times because we all are human. So we think we're going to do this. We're going to have an aging plan. We're going to have somebody. Dad's, mom's down here all by themselves.
Sure.
We're out of the area. We've, talked about this. We're going to do this. And life happens and we procrastinate.
Right.
At least I do. Maybe nobody else does.
It happens to the best of us.
And so yes, unfortunately I have gotten those calls of mom or dad's going to the ER. Can you go find out what's going on?
Yeah.
And we will respond.
And with your experience, the ER and all that is a very familiar place that you know how to navigate. Whereas for the rest of us, it's very intimidating. It's frightening. We're not sure what's going on. We don't know who to even ask for the right questions. If somebody says, wait, the doctor's going to be here, and you don't even know what's going on. It would be very
helpful,
reassuring to have somebody that has that level of experience kind of navigating that whole process.
And it's, thank goodness for electronic devices, and then we attach to our phones, but there's times when they're very helpful, where not only getting the paperwork, tidied up a little bit, at least the HIPAA, but if I can tell you nothing else, please, somebody have a list of mom or dad's medications, if that's at all possible. That's huge. Who's the primary care physician? Because if you don't know anything beyond those two things, we go to the ER, we can call the primary care. Hopefully it's within hours, and isn't always, but if you can have a little bit of medical history, and even if you're telling me this and I'm writing down some things, the last time they were in the hospital is a huge help, because then we can pull some, as we're trying to piece together. It's not the best way to do it, but at least if we have some medications that they're kind of currently on, or if you have some ideas of some of the things, that's helpful.
So it seems really important, especially if you're under that kind of duress, it's a good moment to give you a call. But probably the preferred way, and you said you have a number of clients who kind of work with you on an ongoing basis. They want you to be up to speed in case something comes up. Tell us a little bit about how that works.
Well, you know, we've had clients that have done that. Families out of the area. They're nervous that if something happens to mom, nobody's here close.
Sure.
So we will usually do once or twice a month well checks. And you know, it all depends. We normally have an hour minimum if we're physically going out there. We'll do a 15-minute well check, you know, on the phone.
Wow.
So we'll really try and work with you. So, you know, it all depends. So, you know.
So this doesn't have to be cost prohibitive. You don't have
we're
to
going
feel
to
like
do everything we can to make this as non-cost prohibitive as possible.
So I guess the way I'm taking it is we should not be afraid to give a call to explore this. We don't have to think, well, this is for somebody who has unlimited resources.
No, right. You know, we don't want to do that. So, you know, and I mean, I'll tell you what we charge. For the clinicians, it's $85 an hour. And usually it's a couple hours a month if we're seeing you on a regular basis.
And what's the value of that to somebody as they're trying to navigate? It's incredible, I think.
You know, I think for a lot of times it really is. And the reason I say that is we'll normally go to physicians' appointments
and help
through all that. And we keep records of all of that and track all of that. There's some individuals that we'll see just maybe once a month. It all is dependent on, I know this sounds, if there isn't a need, I'm not going to be there.
That's good. So listen, we are really about out of time, so I just want to squeeze in that phone number one more time.
It's 321-243-6855.
One more time.
321-243-6855.
And I really want to encourage you, viewer, to give a call. You can get a consultation that is complimentary, so you can just get a sense of if this is going to be helpful. And it really could be part of your aging plan. So I want to thank you, Sherry, for being with us today.
Thank you so much for having me.
Thank you, viewer, for joining us for Helping Seniors Television. Hope you have a nice day.
Joe Steckler, thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.